Cinacalcet, also known as Sensipar, is a medication used to treat high levels of parathyroid hormone in people with long-term kidney disease who are on dialysis. It is also used to treat high levels of calcium in people with an overactive parathyroid gland or in people with parathyroid gland cancer. Sensipar works by reducing the amount of parathyroid hormone, calcium, and phosphorus in the body, which helps to prevent bone disease. The typical daily dosage of Sensipar varies depending on the individual's condition and should be determined by a healthcare professional. It is usually taken once daily, and the optimal timing for taking Sensipar is with food or shortly after a meal. When taking Sensipar, it is important to follow your doctor's instructions. Take this medication by mouth with food or shortly after a meal. Do not split, chew, or crush the tablet before taking it, as directed by the manufacturer. Your doctor will provide specific directions on how to take this medication. The dosage of Sensipar is based on your medical condition, response to treatment, and lab tests. It is important to take this medication regularly to get the most benefit from it. Remember to take it at the same times each day to ensure optimal effectiveness. If you experience nausea, vomiting, or unusual tiredness, be sure to inform your doctor or pharmacist. It's important to note that the benefits of this medication outweigh the risk of side effects, and many people using Sensipar do not experience serious side effects. Cinacalcet, the active ingredient in Sensipar, can cause low calcium blood levels, so your doctor will monitor your calcium levels while you are taking this medication. Be sure to notify your doctor immediately if you experience symptoms of low calcium levels, such as numb or tingling skin, severe muscle spasms, seizures, or fast or irregular heartbeat. Additionally, serious side effects such as black or bloody stools, stomach or abdominal pain, or vomiting that contains blood or looks like coffee grounds should be reported to your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. And if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Sensipar, make sure to inform your doctor or pharmacist of any allergies you may have. This medication may contain ingredients that could cause allergic reactions. It's important to discuss your medical history with your healthcare provider, especially if you have low levels of calcium in the blood, seizures, or stomach/intestinal problems. Low levels of calcium can affect the heart rhythm, so it's crucial to inform your doctor of any drugs you are taking or if you have any heart rhythm problems or other heart issues. Before undergoing surgery, make sure to disclose all the medications and products you are using to your doctor or dentist. If you are pregnant, Sensipar should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Sensipar, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Sensipar is thioridazine. If your doctor advises you to switch from using Sensipar to etolcalcetide, you should stop taking Sensipar at least 7 days before starting etolcalcetide. Using both medications together may increase the risk of side effects, especially low calcium levels. Always follow your doctor's instructions carefully when making any changes to your medication. If someone has taken too much Sensipar and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of Sensipar overdose may include severe muscle spasms and seizures. It is crucial to seek prompt medical assistance in cases of overdose. It's important not to share Sensipar with others. While taking this medication, you may need to have lab tests done to monitor your calcium, phosphorus, and parathyroid hormone levels. Make sure to keep all of your medical and lab appointments, and consult your doctor for more information. If you forget to take a dose of Sensipar, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one at your regular time. Don't take a double dose to make up for the missed one. Remember to store Sensipar at room temperature, away from light and moisture. Keep it out of the reach of children and pets, and do not store it in the bathroom. When it comes to disposal, do not flush Sensipar down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Sensipar. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.